My guest is a physician, epidemiologist, and award-winning health journalist. She has been featured as a guest expert on The Today Show, CNN, The New York Times, Forbes, NPR, USA Today, Healthline, and MarketWatch. You're listening to the PHEC podcast, episode 427. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building. Just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm excited to introduce you to my guest on this episode. Let me formally introduce her to you, and then I'll connect our conversation. Dr. Tista Ghosh is a physician, epidemiologist, and award-winning health journalist. She has served as Chief Medical Officer for the state of Colorado, as Epidemic Intelligence Service Officer, and a member of the U.S. Community Preventive Services Task Force. During the COVID-19 pandemic, she advised multiple Fortune 500 companies on workforce safety. Her writing has appeared in outlets including Fast Company, Business Insider, HuffPost, and Kevin MD, and she has been featured as a guest expert on The Today Show, CNN, The New York Times, Forbes, NPR, USA Today, Healthline, and MarketWatch. In 2021, she received the Media Excellence Award for Written Health Journalism from the American College of Occupational Environmental Medicine. Her latest book, Before the Next Crisis, weaves together the voices of everyday Americans in both red and blue states who lived through the pandemic. Their stories offer essential lessons to strengthen preparedness for future public health threats. Let's connect my conversation with Dr. Ghosh right after we highlight our sponsor for this episode. The Public Health Epidemiology Conversations podcast doesn't stop when the episode ends. Now the conversation continues inside the PHEC podcast community app. It's a private space designed just for public health professionals, where you'll find exclusive episode content, member-only discussions, live events, and even chats with podcast guests. No negative noise, no social media distractions, just meaningful connections and support to help you grow. Download the PHEC podcast community app today and join us. Well, I'm excited to have our guest on this podcast episode. Welcoming Dr. Tista Ghosh. How are you?
Good. How are you? I'm so excited to be on.
I'm doing well, and I'm really excited for the conversation. Also, we were just chatting a little bit before I actually hit record, and I'm really fascinated by some of the things that you've already shared with me, and I think this is going to be very inspiring for our audience. So welcome to the podcast. Why don't we just start with you just introducing yourself, tell everyone a little bit about who you are and what you do.
Sure. I'm Dr. Tista Ghosh. I am a physician, a public health physician and epidemiologist. I was with the CDC. I was an Epidemic Intelligence Service Officer. I worked at the local levels. And then at the state level, I was the Chief Medical Officer of the state of Colorado. And I left state government right before the pandemic in 2019. And I ended up during the pandemic consulting for numerous companies, Fortune 500 companies, who had frontline workers that had to work through the whole pandemic. And it was fascinating. These are the people who kept the lights on, who kept our groceries going, who collected our garbage, who kept society running. And they were scared, if you remember the mask shortages and all that. And working with all these different individuals from across the country, red and blue states, rural and urban communities, I ended up collecting stories from people, a lot of different stories, and turning it into a book that just came out. It's called Before the Next Crisis, and it shares voices from across the country, from regular people about what they experienced during the pandemic. So that I'm partially an author as well as a health journalist. I do write articles for the news. And my most current title, besides physician and author, is I'm a senior vice president for employee health for a company that makes the largest maker of heart valves across the world. And they almost shut down during the pandemic. They were making heart valves and ICU equipment, and they were worried that they couldn't keep their plants running, which would mean patients would suffer. So they asked me to come join them and to help keep their employees safe. And so my population has shifted from the state Coloradans to 15 to 20,000 workers across the world and keeping them healthy. But I'm still doing public health, just in a slightly different way.
I love that introduction. There's so much there to dive into, and we will definitely talk about your book. My audience is aware that I'm on my book journey, and I think this is just also such great examples of how public health is everywhere and how you can provide that service and that perspective no matter what you do and where you are. Great stuff for us to dive into. But let's start with kind of going back a little bit. I think it's exciting to hear about what people are doing now, but even more so, I'd love to kind of get a glimpse of that journey. So let's walk the pace a little bit of kind of how you got here. So I guess my first question, and one of my favorite to ask my guests, is when did you first learn about or become interested in public health?
Great question. I actually put this in my book because people ask me this all the time. I never heard of public health all the way till my fourth year of medical school, which is saying a lot. I'm in the healthcare system, and I
Yep.
didn't know what public health was until my fourth year of medical school. I was doing a rotation at a primary care clinic, and I felt like I kept seeing the same patient over and over and over and over. And it was, they had high blood pressure, obesity, diabetes, high blood pressure, obesity, diabetes. It was like the movie Groundhog's Day. It was
Yeah.
just like the same thing over and over. And I finally asked my mentor, I'm like, are we doing something wrong? Like, why does every patient seem the same? And didn't matter what their race, gender. I mean, everybody had the same things.
Mm.
And he said, well, that's a good question. We're just treating the symptoms, not the root cause. The root causes are societal. There are things like our food production changing and people's diets being mostly processed foods, or, we change the built environment. People don't walk anywhere anymore. You have to drive. And there's major societal reasons why we're seeing this. It's not like everybody's genes changed in 2 decades. So those are kind of root causes, and doctors, we're just treating the end result. But if you really want to learn more about what actually caused this and how to get at those systematic causes, you should check out public health. And he referred me to a rotation at our state health department. And then I ended up doing one at the World Health Organization in Geneva. And I got hooked. And so I decided to go back and do a master's in public health and ended up working for the CDC.
Wonderful. Oh my goodness, I love that story. I think that it's very common to hear people say that they didn't learn about public health until further along in their education or even into their career. But I also am equally excited when I hear about how early people are learning about it as well, because we have so many undergraduate degree programs. Some of the high school sub programs, the one close to us has a public health program. So I'm excited to hear that people learn that people are being introduced at an earlier pace. But I think, however it happens at the right time for you and on your path. And what a wonderful positioning and timing for you because you were able to pivot a little bit and those opportunities. I mean, with the World Health Organization and then with CDC, that's incredible.
Yeah. And I think to your point, since the pandemic, public health is much more prevalent. Like people know about it. And now there's more programs. Like when I went to school, there wasn't a lot of undergrad programs.
Hmm.
But now there are. And that's just amazing that opportunity is there now.
Yeah. Is there a particular population or public health issue that you're most passionate about now?
Yeah, I'm definitely passionate about the fact that our public health systems are being dismantled in many ways. But I think what I've become most passionate about since actually working on this book and hearing all those voices from lots of communities, especially marginalized ones, is disinformation and distrust. I think that's the number one public health threat right now is actually the distrust and constant disinformation that's out there, and people don't know what to believe. I mean, you wouldn't believe the stories that I thought that people actually were like, well, this is what I thought was true. And you're like, wow, just wow. So to me, that's a kind of an existential threat to public health and people's health everywhere. So I hope it's something that we can get a handle on and turn around.
Yeah. Well, I am looking forward to checking out your book because I think to hear stories is going to be, I mean, not just that I haven't heard a lot of stories, but just having that as a resource for people and that needs to be disseminated. Over the last few months, I've been in rooms and I've spoken and been in conversations where over and over and over again, we hear the need for more stories. So the policymakers, the legislators, the politicians, they're needing our stories so that they can advocate on their platforms. And there was not ever a time where I heard anyone say, oh, we have all the stories we need. We don't need that. It was the exact opposite. It was coming from the red and blue representatives saying, we need the stories. So I think that having a collection of these stories, like you have, what you've done in the book, is wonderful. And we need more people sharing their stories. I think that sometimes we forget the impact of those stories. It humanizes the data, it humanizes the cause and the need to fight and advocate. So,
Absolutely. Yeah, I totally agree.
well, let's talk a little bit more about your current role.
Hmm.
You mentioned it a bit and you touched on that, but can you tell us a little bit more about, the work that you're currently doing?
Sure. So I came on into that role in the middle of the pandemic, trying to keep these plants open across the world and
Right.
that were supplying hospitals around the world. So that was my charge, keep them open somehow.
Yeah. No pressure.
No pressure. And what, was fascinating, I'd been mostly in a US context. So I suddenly got the world, and
Hmm.
everyone was in a different stage in the pandemic. And I remember we had a plant in Singapore that had workers from Malaysia that crossed the border from Malaysia to work in the Singapore plant. But Singapore announced they were going to shut down their border in 24 hours between Malaysia and Singapore. And we had to say, we'll put you up in a hotel if you want, like, we don't know how long this is going to be, but if you want to work at the plant, like, we'd really, really appreciate it if you would just move to Singapore. You can bring your family
Wow.
24 hours. Yeah. And it ended up being for a really long time, like a year. And then there are places, we had plants in Costa Rica that couldn't get vaccine, and here in the US, people weren't taking the vaccine, and there we couldn't get the vaccine. So it's just like various challenges depending on where in the world it was. And just trying to keep up with the sheer volume of information was insane. But one thing I will say is that working with the private sector is different in that they have resources. So, for example, I suggested what would help keep the plants open. improving the ventilation in all of them, like so that it's like you're being outside.
Yeah.
And that's expensive. We could have kept all the schools open if we could have done that. Could have done so many things, right? In public buildings. Like it just wasn't viable. But they said yes, and they did it.
Yeah.
And those plants stayed open at 75% capacity, but they never shut down during the whole pandemic. And we only had maybe 2 or 3 deaths among our entire workforce, which again was, I think, a lot of the ventilation, their ability to get a lot of these protective measures in. And so for me, that was eye-opening because I had been working for the government for so long. I was like, oh, so you just said, yes, we'll change the ventilation? So that was shocking to me. But it was also interesting to see public-private partnerships. Like when they did get vaccine, they'd vaccinate the whole community, not just the workers. So there were a lot of interesting learnings for me, just having come from the public sector to the private sector to see how well like a public-private partnership could work and benefit the whole community. So it was a wild ride. Now I work more on either emerging threats, which are often climate change related, or just keeping workers healthy and safe from anything from safe driving and workstations to psychological burnout, psychological safety. So it's a whole gamut. And I work with people of varying socioeconomic status. I work with the whole world. So every culture you can imagine. So a lot of cultural issues come up when you have Italy working with Japan, and that's an interesting cultural setup. So everything and throw in South Africa, it's been a huge learning curve for me, but I've loved every minute of it.
There's so much to unpack. As you're describing the scenario in your situation, I also worked for a global organization when I left government and went to private industry before starting consulting. And I definitely understand when you move to a perspective of the world, looking at country to country, and it's very different than just our domestic challenges, and also a different structure working in private industry versus public. But a few things stand out to me or kind of caught my attention as you were talking. And the first thing, of course, is a company that's making this product that is literally life-saving for people around the world. And the thought or the stress or the pressure of not being able to continue in providing that life-saving device is mind-blowing. But we know that that was the case for not just that company, but so many other companies during this situation, this time. Another thing I thought about it as you were talking was, and I talk about this a lot on the podcast, but this intersection where public health intersects so many other industries and how it takes all of us together to solve these problems and to advance the health of populations of people. And you gave some great examples of, how you've been able to play a role in that. So what I'm thinking about is, and we touched on this a little bit before we hit record, but as we think about what's next, like what do we learn? What are those lessons learned? We've got the stories, we've got these lessons learned. Now we're in this, whatever this place that we are now, we're not active emerging. Well, we have a lot of emerging threats. We have a lot of eyes on a lot of things, but what have we learned from going through COVID-19 and that pandemic that we can apply to be prepared for the next? Because we know it's not a matter of whether or not it'll happen. It's just when. And I don't know if that's something that you wrestle with on a regular basis or if it's in conversations, but I'd be just curious to know your thoughts on that.
Yeah, actually, that was the whole theme of my book, because I feel like there's all these pundits talking about, well, this is what we should do, or this is what we should do. And the approach I took in the book was not me as an expert, but me just as I'm a platform for these people's voices. And what was fascinating to me is they actually, if you read all their narratives, there's themes of what we should do. And one of the big themes that I heard was local context matters a lot. And what we did during the pandemic was we kind of crossed the board, March 2020, most of every state shut down, and it was like the whole world shut down all at once, bam. And there were places, there's a construction worker in my book who was in the South working, and there was no cases in the community. He was building hospitals, so he's working the whole time. And they didn't have any cases. So he was like, why are they doing this? He had to try and convince his coworkers to wear masks and while they were outside. And he's like, I can't get construction workers to wear helmets, much less masks for a virus where they haven't even met a single person who has it. And then by the time it came, because it came in waves, but it came to different communities at different times, his coworkers didn't believe it was real. They thought it was a hoax. And many of them actually, were high risk, and some even died as a result. So that was just one example. But it was a theme everywhere. Whereas if you were in New York City in March 2020, that was the scariest, most horrible time ever. And it was, there were refrigerated trucks going by with dead bodies, and Central Park was a hospital. So, I mean, just where you were in March 2020, you could live in rural Texas and you don't have any neighbors for like 10 miles. So you're like, why do I have to stay in my house? So I think local context matters. And I think that, and explaining to people how science evolves, like this was a new virus. This was something we didn't know about. So it wasn't like that people were maliciously making stuff up. It was that we honestly had no idea when we were learning. And science is a process. They're used to seeing the end of a process,
Exactly.
not the real time action. And I think in education in general, we need to do a better job of explaining the scientific process so that people aren't shocked that we don't have a definitive answer when something new happens, whether it's a virus or some weird climate thing or a chemical, whatever it is. We probably don't know. And let's be honest, we probably won't. And we'll learn new things and we might have to pivot. And having a better grasp of this scientific process, I think in high school, in middle school even, and it being part of our just general societal knowledge base is important, I think, because something like this is going to happen again and no one's going to believe anything.
Right, right. Those are great points. I'm loving this conversation. I'm thinking about connecting the dots, public health, epidemiology, and other industries. We've talked about this, but how do you explain the importance of the work that you do and its connection to public health or epidemiology in conversations with family, friends, community?
That's a tough one. I think I'll say pre-pandemic, it was harder.
Mm-hmm.
Post-pandemic, people actually know what public health is. But then now there's distrust related to that word.
Mm-hmm.
Or those words. So I think I explain it as we're the folks trying to get to the root cause of illness or absence of health and trying to make it better for all people in a more equitable way. So they sometimes get that, sometimes not. But I think one of the best examples I have is I talk about if you walk down the street and you fall into a pothole and you break a hip, you end up in the emergency room, you end up in the hospital, then you have physical therapy, and you finally feel better. You write 5-star reviews for the hospital and the physical therapist and the surgeon. You're super happy with them because you know who they are. But what if someone put cones around that pothole and you never fell in? You wouldn't write them 5-star reviews. You'd just keep walking because you never fell. And to me, the cones, that's public health. And so often we're behind the scenes, but if we're working properly, you probably don't know we're there. And I'm guessing you're glad that we're there because you'd rather not break a hip, but you don't think about it. So that's one of the analogies I use with people.
That is a great one. I like that a lot. Actually, it reminded me of a story with my family. So that's exactly, we need more of those because when you explain it like that, someone can understand that story and then it'll make them think about something that is relatable and they'll remember that. That's wonderful. Okay, just a couple of more questions and then we're going to wrap up. I'm thinking about my audience because we do have a very diverse audience of listeners. What is one bit of advice or tip that you could give someone, maybe public health student, professional, entrepreneur, who may be listening to this conversation and may also be interested in doing similar work as what you're doing?
Yeah. First of all, I would say keep an open mind. Your career doesn't have to take one certain path. You can work for the government. You can work for the private sector. You can consult. You can hop back and forth. Your career can be fluid and just don't get attached to one sort of outcome. Just let your path lead you where it will. And then my other is to actively listen to the communities that you serve. Because a lot of times we think we know what people are going to say, and that's not what they're thinking. And I learned a lot from the book that I wrote because I thought I'm an epidemiologist. I knew what the pandemic was about. And it's humbling to talk to people and realize that there's people who lost their business because of the pandemic and the mixed messaging. There's people who didn't go to school for several years and can't read when they should be able to. There's disadvantaged communities that got even more disadvantaged as a result of some of the public health policies. So the anger that people feel, rather than just brushing it aside, understand it, and then we can work to correct it.
That's good. Yeah. So as we wrap up, thank you for being so generous with your thoughts and insights and time. What is the best way for our listeners to connect with you?
Yeah, I have a website, TistaGhoshAuthor.com. So it's my first and last name, author.com. And there's a way to contact me on there. And I'm happy to connect. And I love mentoring students. So happy to connect with people.
Wonderful. Well, I'll make sure that we'll have all of that on the show notes page. I'll let everyone know in just a little bit how to find the show notes page. Thank you so much for taking time to come here, for reaching out to us. And I'm excited to check out your book. I'm assuming that people can get that from your website. Is there a link to purchase the book from your website? Okay. So we will make sure that that is all available. And we're going to be in touch. I think it will be really interesting to see, we fast forward a few years. When we started this podcast, I just thought there's always an unlimited number of people. I can always talk to someone different, which was great. And then a few years in, about 5 or 6 years in, we started to have some repeat guests that we bring back. And I found that was the most fascinating conversation after a few years have passed, to come bring a guest back and see where they are and how, like you talked about, your path can take you, a little bit to the left or right, or, it's not a straight line. So it will be really interesting to see where you are in a few years. So we'll definitely have to bring you back.
I'd love to come back. Thank you for having me.
Awesome. Thank you again for being here. This has been great.
All right. Take care.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Dr. Ghosh and learn more about the work that she's doing. I also encourage you to read her book. I'm looking forward to diving into it myself. When you reach out to her, make sure that you let her know that you heard her episode on this podcast. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 427, can be found at phecpodcast.com. Once you're there, just navigate to episode 427 to find the show notes. One more thing before you go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download our new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.